Welcome to the session on the BID model, a structured approach to teaching procedures in psychiatry. While psychiatry is often associated with diagnostic interviews and therapy, procedural skills, such as managing emergencies or performing diagnostic assessments, are essential to comprehensive patient care. Today's session has three objectives. First, to introduce the BID model and its three phases. Second, to explore examples of its application in psychiatry. And third, to discuss how this model can be adapted to the unique demands of psychiatric practice, focusing on patient-centered care. The BID model is a teaching framework with three phases. Briefing, where the educator prepares the learner by setting expectations and reviewing key steps. Intraoperative teaching, where the educator provides real-time guidance and feedback. And debriefing, where the educator and learner reflect on the experience to reinforce strengths and identify areas for improvement. This model promotes deliberate learning while maintaining a safe and supportive environment. In psychiatry, the BID model provides structure to teaching procedural skills that are crucial in managing acute situations, such as psychiatric emergencies and conducting diagnostic assessments. It ensures learners develop the skills they need while emphasizing patient safety, rapport building, and ethical considerations. Let's consider the mental status exam, a foundational skill in psychiatry. In the briefing phase, the educator explains the purpose of the MSE, such as evaluating a patient's cognitive, emotional, and behavioral state, and outline the key components including appearance, thought process, mood, and insight. During intraoperative teaching, the educator observes the learner performing the mental status exam, offering real-time feedback on their phrasing of questions, active listening skills, and ability to interpret responses. In the debriefing phase, the learner reflects on their performance and the educator provides feedback, for example, on areas like improving eye contact or refining their interpretation of subtle behavioral cues. It's at this point you can incorporate the 1-minute preceptor to reinforce medical knowledge and use the RHYME method of evaluation to target feedback. Another example is managing a psychiatric emergency, such as a patient experiencing acute agitation. In the briefing phase, the educator reviews the goals, such as ensuring safety and de-escalating the situation, and outlines key steps, including identifying triggers, using a calm tone, and employing de-escalation techniques. During intraoperative teaching, the educator observes the learner and provides guidance, such as suggesting adjustments in body language or tone of voice. In the debriefing phase, the learner reflects on what went well and what could be improved, while the educator offers feedback, such as strategies to maintain safety and build rapport while under pressure. Now, let's discuss how the BID model applies to psychiatric teaching. How can educators integrate the BID model into scenarios that involve non-invasive procedures like diagnostic interviews? How can we adapt this model to balance teaching with the need to maintain therapeutic alliances? And what strategies can be used to provide feedback in emotionally charged situations? The BID model is a valuable tool for teaching procedural skills in psychiatry. By focusing on preparation, active guidance, and reflective feedback, it ensures that learners develop not only technical skills, but also the interpersonal and ethical competencies essential for effective psychiatric care. As you prepare to teach your next psychiatric procedure or assessment, consider how the BID model can enhance the learning experience while maintaining a focus on patient-centered and ethical care. Thank you for your attention, and we encourage you to apply this model into your teaching practice. For further elaboration on the use of the BID model in tandem with the 1-minute preceptor, please visit the main Rural Healthcare Education Grand Rounds presentation on this topic. In the Merge archive, you'll find a valuable resource in these video segments that provide tips, tricks, and models to help facilitate efficient and effective precepting while providing phenomenal patient care.